Good afternoon, everyone. My name is Erin Long, and I lead ACL's Alzheimer's and Dementia Programs Initiative, and I'm going to be your host today. I want to thank you for joining us today for the National Alzheimer's and Dementia Resource Center's webinar, Choosing, Implementing, and Evaluating Dementia Programs. Know the Key Factors. The National Alzheimer's and Dementia Resource Center webinar series is supported by the Administration for Community Living. Our presenter today is Ashley Cordell. We had a last-minute change in our lineup, and Sarah Schumann will not be able to join us. We're thankful to Ashley for her willingness to jump in and deliver the webinar in its entirety. Ashley Cordell, MGS, is a public health. Oh, goodness. Ashley is a public health research analyst at RTI International, where she works on the National Alzheimer's and Dementia Resource Center and provides technical assistance to our grantees. She's helping the grantees as they establish dementia-capable communities. She's a gerontologist and researcher with 10 years of experience in the field of dementia, facilitating intergenerational arts programs and implementing evidence-based and evidence-informed interventions for older adults and caregivers. In addition to co-founding a nonprofit organization calling Promoting Art and Intergenerational Relationships, PAIR, Ashley has specialized roles within research and long-term care as an activities and memory care professional. She holds a master's degree in gerontological studies from Miami University. At this time, I'll turn the presentation over to Ashley to begin.
Thank you very much for that introduction. And today we're going to be going through a very speedy journey through choosing, implementing, and evaluating dementia programs. We all know that each of these components in and of themselves take much, much more time than an hour to discuss and analyze and get through. So that's why today we're only going to cover the key factors of each of these components. Before I jump into this information, I do just want to acknowledge and give credit to my co-presenter, Sarah Schumann. Even though she will not be here presenting alongside me today, I do want to recognize that the content that I'm going to cover today is both her and I's work. So today we are going to go through 3 objectives, and by participating in this webinar, you should be able to understand the difference between evidence-based and evidence-informed dementia interventions. Also, become more familiar with the process of choosing, implementing, and evaluating dementia programs. And finally, we hope that you'll learn the key factors to consider when you are choosing, implementing, and evaluating your programs. Next slide, Cameron. This presentation is going to be broken down into those 3 key phases: choosing, implementing, and evaluating. And so this first stage that we'll spend some time talking about is choosing a dementia program. Next slide, Cameron. So there are a lot of pieces and components that go into one's decision for choosing a program to deliver. Today, we're going to just focus on 6 considerations that are also described in one of our deliverables, which is the Grantee-Implemented Evidence-Based and Evidence-Informed Dementia Guide. This is going to be discussed further later on in the webinar. So know that even though we're only going to broad base cover these 6 features, you'll be able to dive deeper into them after today's discussion. But the 6 things that we are going to focus on today for choosing a program include readiness, the program characteristics, licensing information, training details, availability of technical assistance, and also how to manage your data. Next slide, please. So the first consideration that we're going to talk through is readiness. And this means the extent to which your organization is ready to implement a dementia program. So to determine your readiness, you'll need to consider a variety of factors. And you can ultimately think about the extent to which there is a need for each of the services and supports that are offered within the program that you'd like to implement. So If a service is already delivered in your area, do you need to deliver it too? Or would it make more sense if you try to partner with an organization who is already providing that service or support? And so some questions that you may be asking yourself at this point is exactly what dementia services already exist in my community? And further, who is delivering those supports already? Will existing services and supports overlap with those things in which I'm choosing to implement? Once you've established some of those initial thoughts, you should also consider the internal support that you have for your program. So if you don't already have the leadership or other support that's needed to develop or implement the services that you're looking to deliver, do you have the ability to get that support that you need? Is there a person in your organization who will stand by your idea and your passion for the project that's going to help support you if you need to get key decision makers on board? So some consideration questions here is, does your organization have this internal support? And if not, do you have someone in mind who is going to support your efforts in your development of implementing a program? And do you yourself have the necessary time to engage that person or that group of people to prepare your organization for this work? And finally, while assessing your readiness, you should also think about your overall available resources to you. Do you have access to other resources such as funding, supplies, data, maybe the staff with the necessary skills, the experience, or the training to deliver this program? And if you're thinking no, are you able to gather the resources that you need to be ready? Or do you have the partners in mind who you can collaborate with to help gather this information that you need? Ultimately, how are you going to get these resources? Next slide, please. And then we're going to dig into these program characteristics. So once you've determined that you're ready, you should begin assessing the program characteristics to determine if it's a good fit overall for your organization. You should ask yourself, does this program address all the areas that we planned on wanting to address? Will your organization have to add to the program to meet all of the needs? And when you look at the various aspects of the program, can you implement these immediately with the staff that you have on hand? Or do you need to hire new staff or partner with those other organizations to get that expertise that you need, that you may not have immediately at your fingertips? You should also be considering what are the outcomes that must be measured as part of this program. And do you have the capacity to measure those outcomes on your own? And finally, is this program a good fit for the communities in which you plan to serve? Has it been implemented in similar areas before? Are there lessons learned that you can turn to? And how can you apply all of this information to your own work? Next slide, please, Cameron. And looking at the licensing category, there may be fees that are required by the program developer, so you need to consider if these are something that you can manage. How long do these licensing costs last? How many people can use the license? And how many people can be trained under said license? It's also important to keep in mind that training may not be included in the cost of licensing. And if it's not, how are you going to make sure that those funds are secured? You'll need to find out if training materials are also included in these costs. And you'll want to know if there are any data reporting requirements that are associated with having this license. So again, some questions to ask yourself at this point. What are the licensing fees and how long is it good for? How many people can be trained under one license? Are there additional costs to have more people trained if that's what you think you need? Are the training materials included in the cost of the license, or are these excluded and there's additional fees? And lastly, are there data reporting requirements that might send you back to the program developer for further questions. Next slide, please. Training. So this tags along with the licensing piece, but thinking deeply about this, while your organization may have the appropriate staff to implement the program, they may also need additional training in order to become an interventionist for the program. So you're going to want to consider what are the costs for the training and if this cost was included in that licensing fee. You'll also want to know the length of the training, so how much time your staff is going to need to prepare, and if this is delivered in person, where travel's required to get there, or if it's online, or if it's some kind of hybrid fashion. If it is in person, does that trainer come to you? Do you have to travel to them? And how many people am I allowed to have attend said training? If it's going to be a long time, that's going to require more planning. And keep in mind that you are going to have to pull your staff from their regular obligations to go through said training. And then finally, think about the idea of having a master trainer. Is this available to the program that you wish to implement? This person can later train other people in your program as it grows and develops, maybe as staffing changes or staffing needs arise. Next slide, please, Cameron. Thinking more about technical assistance. This is who is going to help you and how they will identify help for you if you need it. So, is technical assistance available as part of your program that you want to implement? If it is available, what does it cost and who provides it? How long is it being offered to you? Is it just for a short period of time, or do you have access to this support throughout your entire implementation? What topics can be addressed, and how is this technical assistance provided? Is it through coaching calls or one-on-one meetings or something else? And if it's in person, again, do you have to travel to them to get the assistance that you need, or are they willing to meet you where you're at? And then on the flip side, if there is no technical assistance provided, how do you envision getting the assistance that you need to run your program? Next slide, please. And the final piece that we'll cover on this topic is data management. So we'll discuss, there's a few key questions to consider when you think about collecting data, managing that data, and then finally reporting on that data. And so think about if you have to use a proprietary data management system. If yes, how will that system fit into your organization structure? Is there a seamless pipeline for this? Do you need to make considerations or alterations to the way that you store this information? How will you use this data, and how will it require that you get this consent from your clients? Will the program developers require you to store data on their systems? If so, do you have easy access to that data? And how is this going to integrate with your system that you have in your organization? Next slide, please. These are a lot of questions that you find yourself having to answer and being faced. And so I would like to present the NADRC's newest resource on Grantee-Implemented Evidence-Based and Evidence-Informed Dementia Interventions. This resource is available on the NADRC website, and it was developed at the request of ACL. This resource is intended to support the work of Alzheimer's Disease Program Initiative grantees and others who are dedicated to engaging and supporting those living with Alzheimer's and related dementias, along with their caregivers. This resource covers the purpose of evidence-based and evidence-informed interventions. It goes into describing how those interventions are organized. It gives you guidance for choosing an evidence-based or evidence-informed intervention. And then it's followed by 3 appendices with lots and lots of information of recommendations to consider when choosing an intervention. It gives you a list of previous grantees who have implemented those interventions in the past, as well as some publications that have been developed as a result of grant funds. Next slide. So one of the main resources identified in this resource is the difference between evidence-based and an evidence-informed intervention. And so, as I mentioned, the purpose of this resource is to assist grantees and others with identifying what the difference is between these 2 types of interventions, and making sure that they meet the ACL requirements. And for consideration as evidence-based, an intervention must have been tested through a randomized controlled trial, and it must have been shown effective at improving, maintaining, or slowing the decline in the health or function status of people living with dementia or their family caregivers. It must also be suitable for deployment through a community-based services organization and involve non-clinical workers or volunteers in the delivery. It must also have research results published in a peer-reviewed scientific journal, and finally be translated into practice and ready for distribution through a community-based services organization. In our resource that I just showed the cover of, there are nearly 20 interventions identified that are evidence-based. For consideration as evidence-informed, that intervention must have substantive research evidence that demonstrates an ability to improve, maintain, or slow the decline in the health and functional status of people living with dementia or their family caregivers. These evidence-informed interventions have been tested by at least 1 quasi-experimental design with a comparison group with at least 50 participants, or they've been adapted or translated from a single evidence-based intervention. Similarly, in that guide, we have nearly 20 evidence-informed interventions. And while our grantees are not required to choose an intervention from this resource, they may consider all of these expectations when making that decision. And so I referred to some of the information that's available in the appendices, but Appendix A specifically contains questions that should guide decision-making when you're choosing an intervention. Next slide, please. Getting a little bit more detail as to what you can anticipate when you're clicking through that resource, you'll notice that there are some color-coded tables within the guide, and the tables consist of evidence-based interventions that are color-coded in blue and evidence-informed interventions that are color-coded in green. These snapshots come from the resource itself, so that they correlate nicely with what you can expect to see when you're taking a look for yourself. You'll notice that our 2 tables each have 4 columns. The first column is going to identify that name of the intervention. It's going to provide the target population in which that intervention serves. In our case, we're either talking about people living with dementia, their caregivers, or perhaps both of them. And then it'll also display any original study that was published on this intervention. Appendix C will list any other publications that have been developed as a result of implementation. The second column of the table shares information related to a brief description of the intervention. So things that you can find in this column include the delivery method, whether this intervention is suited to be delivered in person, maybe by telephone, virtually, or maybe some kind of hybrid mix of multiple methods. You'll also find information on session length and the program length. So overall, how long is each individual session, and then about how long is the entire program. Third column provides more detailed information about that intervention as available. In this column, you'll see links to intervention websites. You'll see information about that licensing and training requirements, any additional materials that are associated with the intervention, what the costs are, and then, of course, contact information so that you can reach out for more information regarding the intervention itself. In that final column, this is where you'll be able to see a list of ADPI grantees that are currently implementing the intervention. And as I mentioned in the bottom appendix, Appendix B provides that historical reference for grantees that have implemented that intervention in the past. Next slide, please, Cameron. So that is a quick overhaul of just one guidance document that you have to reference. And so now that we have our seatbelts on and we've done a speed run through choosing an intervention, next we're going to talk about how we implement that intervention. Next slide, please. So here comes those questions that we've already been thinking about. We don't leave those behind when we're entering the implementation phase. We're actually going to integrate all of those programs and those questions that we've been asking ourselves into an implementation plan. And so our grantees that have implemented a variety of interventions go through this same exercise. And so regardless of the type of activity or intervention you're looking to develop, anything from activity programs to support groups to education and training, you'll find examples of all of that here. The important thing to think of is when you're implementing an intervention, it's important to map out all of those considerations that you had started thinking about in the choosing phase. And so you should recall all of these questions that are here on the screen. Who is the target audience? How are you going to market the program? Who is going to deliver that program? Is it an interventionist? What are the licensing and the training requirements? What are the delivery protocols that these people need to follow? How are you going to ensure program fidelity? What is your plan for sustainability? What materials are needed? And who is going to be responsible for monitoring the budget? So it's at this stage that you're turning to your answers to these questions. And again, the process is repeating itself here. Next slide, please. Here's an overview of the journey of the implementation plan. So we always like to emphasize that implementation is a process that requires very intentional planning and time. And this isn't all going to happen at once. So there are many tools available for constructing your implementation plan. And some people turn themselves to a checklist to keep them tidy and on pace. Maybe that's an Excel template for you or another online program. What's most important, though, is that you choose something that's going to work best for you to keep yourself organized. Thinking about our plan, we're going to start with documenting the rationale for implementing this intervention. This is where we outline the goals that we hope to fill, and ultimately it communicates what you're hoping to achieve. Next, we want to describe the intervention protocol or its delivery. Here's where we want to start thinking about what are the roles of other partners that I need to deliver this intervention? What are the number of sessions and the frequency and the mode of delivery and all of those details? Who do I want to serve with this program? And what materials are needed? And if you're going to adapt an existing intervention, you need to figure out how is that going to be different from the original intervention and map that out here. Next, you want to start thinking about defining your budget and additional roles and responsibilities. So chances are this program is going to cost you. What are going to be your sources of funding? Are any of these ongoing? You need to identify who is going to take ownership of all of the tasks that you've started listing out that need to be accomplished. Who's delivering on those tasks? And what are your recruitment strategies going to be when you're ready to go live? The fourth step in our route is to define your outcome measures in your data tracking system. So here's where we're thinking very heavily about intervention fidelity. Is this proposed protocol for delivering the intervention consistent with how it's intended to be delivered? So your protocol may include things like your number of sessions, your frequency and mode, but do you need to make adaptations to this protocol? Is there also a method for determining if and how individuals are adhering to such protocol? Some examples might include, again, using a checklist to monitor fidelity. Or maybe you have a master trainer that provides supervision to those who are implementing the intervention, and they're able to monitor the fidelity that way. Our fifth step is to identify risks and propose mitigation strategies. So beginning our plan with understanding that every plan has risks, but if we're able to identify some of those in advance, we can put strategies in place to help mitigate those. For example, what happens in the event that a key personnel goes on extended leave or leaves your team entirely? Do you have a backup? The sixth step is to set your intervention milestones. Here's where we're thinking about a very clear timeline to ensure that our key steps are being implemented along the way and that we can track our progress on each step. Step 7, this is the fun part, implementation. Remember here that it is not going to be perfect, and that's why the final step is very important. We want to reflect on how implementation of the intervention is going and always revise as needed with sustainability in mind. The odds are very likely, like I said, that everything that you initially thought isn't going to go according to plan. So remember, implementation is a process which allows for ongoing improvement. It's important to document your successes, your challenges, and your lessons learned, and also share these, not just internally, but with your project partners. It's also important that you're exploring alternative funding sources and that you're embedding your activities, such as making training as part of an onboarding process for future staff to come through. Next slide, Cameron. That was an even faster journey through implementation. Finally, though, I'm going to turn our attention to the final phase that we're going to talk about, which is evaluating your dementia program. Next slide, please, Cameron. Talking about evaluation, there are many benefits. We're going to start by talking about why it's so important. Evaluating your program is going to help you determine what is working well and what may need to be adjusted to gain more positive results. So in addition, once you have those positive results, you want to report out on them. And those results can be used in a variety of ways. You can package these to boost your program participation. You can also help utilize these results to get further financial support for the program if you show it to potential funders. And then also just simply knowing the benefits from the people experience from their participation. One tool that you can use to find evaluation instruments is the National Alzheimer's and Dementia Resource Center evaluating dementia services and supports instruments list. That is what's highlighted here in blue on the slide. This list is linked in the slides, and you'll receive a copy of that to you after the webinar today. Next slide, please, Cameron. And a little bit more on focusing on the outcomes of your evaluation. When you conduct an evaluation, you're going to want to ensure that you're examining what we're calling measurable outcomes. Here, a measurable outcome is an observable end result that describes how a particular intervention benefits the consumers. So maybe it demonstrates an increase in function, or an increase in mental well-being, or more knowledge, or more skills, or better attitudes toward a specific behavior. It's really important to clarify such measurable outcomes, as they are different than measurable outputs, which outputs tell us how many or how much, such as the number of clients served or the number of training sessions held. This information is important to know, but it doesn't get at the impact of your program. Next slide, please, Cameron. So a final review of what we mean by a measurable outcome. This is the observable end result that describes how a particular intervention benefits your consumers. So again, it may lead to improved well-being, more knowledge, more skills, but your outcomes from the project targeting individuals living with dementia or their caregivers can also include a variety of items. Maybe you're interested in a change of quality of life for that person with dementia, or maybe you're hoping to receive a change in unmet need or a change in stress level. Maybe a change in caregiver self-efficacy, or a change in the responsiveness or the cost effectiveness of a service system. Outcomes related to training professionals in dementia may look a little bit differently. Maybe in the professional space, you're looking for a knowledge change or additional skill attainment or confidence in serving persons living with dementia or their caregivers specifically. It's important to clarify that these measurable outcomes are different than outputs. Again, those numbers that we were talking about. So as you start to continue your work related to implementing a program, you can use this information to help guide you as you move forward in your work. With that, I'm going to pause here for a second to say we have been through an entire journey here together through choosing, implementing, and evaluating a program, and certainly the journey takes much more than what we've covered today. But next slide, please, Cameron. At this time, I'd like to open it up for questions.
Thanks. Thanks so much, Ashley. You did a great job. Again, thank you for jumping in and doing the whole presentation on your own. Fabulous. I hope that everybody appreciated the depth in which Ashley delivered all the materials that are based on the resource, our resource on choosing your interventions. You can put, if you have any questions, you can put them into the Q&A section of the bottom bar on your screen. Right now, we don't have any questions. Just want to thank everybody for coming today, and we're going to give you a couple seconds or minutes to put in any questions you might have related to choosing your interventions. I think it's important for all of these considerations are so important to ensure that you are meeting your community's needs. It's often, important to sometimes people forget to check in with their community to make sure that they're bringing services and supports that they want and they're willing to receive. In the questions, there is a question here on, do you have measurement tools for the outcomes? I'm going to jump in on some questions just because I work with Ashley and Sari and have a little insight too that Ashley may not have in terms of the question. So measurement, Ashley mentioned the evaluation instrument tool, that resource that's on the NADRC website. It provides a broad range of tools that are validated and reliable that measure the outcomes, the various outcomes that could come from an intervention. When an intervention is an evidence-based intervention, they typically, when you do your research, they'll typically articulate what they saw as their outcomes. And then for the ACL programs, you just choose which of those outcomes are most important for you to focus on, because as we're delivering services, we also need to be very mindful of the burden on the people that you're asking to complete your surveys to get your outcomes. And so you don't necessarily have to go for all the outcomes that they did in the research, but you can find out about as you're researching, you can find out what they say, the impact that program is going to have. So there's a question here, Ashley, on what is the process of having an intervention included on a list of evidence-informed interventions? Our resource is just simply a list of things that grantees have proposed and we've approved for them to deliver. That those are things that organizations have presented to us. It is not a list of approved interventions that one has to choose from. It's just, and to be evidence informed, it is literally an evidence-based intervention that is taken down and modified to in one level down from an evidence-based. It still has to have the research behind it, but it's one level down. And for instance, you could say it was an intervention that was for research, was tested in a nursing facility, a skilled nursing facility, but we want to implement it in the community. So that would make it, music and memory was researched in skilled nursing facilities, and it has been modified to an evidence-informed form to bring it to communities. There's a question, what would be a typical licensure cost of an intervention program? Ashley, do you have thoughts on that?
This is not going to be a definitive answer, but I can say, just by flipping through the resource guide, you'll be able to tell that this varies significantly program to program. I will say that for most of the interventions that we've had grantees develop, this information is available, oftentimes either directly through the resource or by direct conversation with the developer as we provide contact information. I don't think we have an average cost, but I can say that most of them do have a cost.
But I would add to that, I think you're right, Ashley. I would add to that some interventions have a cost for a training, but don't necessarily have an ongoing licensure fee. So that's an important thing to consider too, is you may have money to get everybody trained in an intervention. If you've chosen an intervention that doesn't have ongoing licensure, as long as your staff stays, then you don't have to keep paying. You just you have to keep paying to have your staff deliver it from whatever supplies it takes to deliver the intervention. Let's see. Just a couple compliments on timely information. Ashley, do you know how long it takes to implement a sound dementia program?
That's also a really great question. I will say we talked about implementation also being a long phase. So thinking about the planning that goes into that, and then also however long your intervention is going to be, these are things that don't just happen overnight, of course. And I think, again, that's another one that's dependent. But I don't think that when you're considering how long an implementation of a program takes, you really can't just consider the rollout of just delivering that intervention. So you really need to build in that time for the planning and your resource and your fact checking and all of that stuff too. So I know I'm spitting another undefinitive response out there, but
I would just add to that that part of the implementation is also getting the people to receive it from you. So you have to do all of your recruiting. So you know, the steps: identify, then decide, then get everybody trained in all of your locations, identified wherever you're going to deliver it, if you're going to deliver it in person, if you're going to deliver it online, depending on the intervention, but then recruiting and building like even a referral pipeline. So there's many things that have to be thought out before you're actually like in there working with people and getting those services to people. Let me see if we have another question here. Is there a list of programs somewhere? You want to recap that for us, Ashley?
Absolutely, there is. And so we conveniently have a slide in our slide deck that links you to the newest resource that's available on the NADRC website. Again, our resource only provides a list of evidence-based and evidence-informed interventions that have been developed by our ADPI grantees. So it is not necessarily comprehensive list. There may be other interventions that exist outside of what we have captured. However, I will say there are almost 40 interventions available on our resource, so it is definitely a great place to find a lot of information.
Absolutely. And I would say one thing I would add is the Benjamin Rose Institute also has a website for professionals they do a really deep dive into evidence-based interventions. They don't have evidence-informed interventions, but if you Google best practice caregiving, you can find the Benjamin Rose Institute's webpage that they do a deep dive. Last I heard, I think they had about 40 interventions, and that's dementia specific interventions. And they have many of the ones that our folks have implemented, but they also have some that our folks have not implemented. So you might have a little bit of diversity in interventions there as well. If you couldn't find what you wanted and what is on ACL's resource list, then you might be able to find something there as well. I don't have at this time, I don't have any additional questions. We'll just give a second or two for more questions to be put into the Q&A button, pod, whatever it is. But again, thank you so much for joining us and for giving us some good questions. We are very proud of the work we do at ACL, and the NADRC is a great resource. So I think with that, thank you all very much for your time. I think, Ashley, everybody gets a copy of it in an email after this.
They
And
do. And Cameron, can you go one more slide, please? I just want to highlight the fact that part of the slide deck includes direct contact information for myself and Sari. So although you will be receiving an email with all of the materials that we went over today, if you have burning questions that come to you after the webinar, you can always reach out to us too afterwards, and we'd be happy to continue the conversation.
And I would just encourage you all to go look at the nadrc.acl.gov, that website. There are tons of resources there, because all of our funded programs are paid with taxpayer dollars. Whenever anything's delivered, everybody gets to benefit. So there's a lot of really good tools there. Even if you're not ready for, you may not be ready to do an evidence-based intervention. There's a ton of trainings that aren't the evidence-based ones, but there's a lot of good resources there in addition to the ones that were highlighted on this webinar today. So thank you very much for your time. Thank you again, Ashley and Cameron. And hopefully we have another webinar coming up soon, but I can't remember what it is. Oh, is it there? It's not there, but and then also just reminding you that ACL does have its Alzheimer's disease program initiative that we fund each year. We just funded some in September, and then in the first quarter of next 2025, we will have another round. So please keep your eye out for that. And if you have any questions, use this address here to contact the resource center. Have a great day, and thanks for your time.
You're welcome.